basically the objectives of my talk tonight is really to try to give you an evidence-based approach to injury prevention for the overhead athlete, as well as give you some fundamentals on injury prevention programs for these athletes. But I hope that you also come away with some updated information, and I'll leave some websites that you can review as well. The bottom line, the prevalence of upper extremity pain amongst overhead athletes actually can be quite high. What's kind of alarming is with competitive swimmers, up to 91% of swimmers in a competitive season may develop complaints of shoulder pain. And the pathologies that can affect the overhead athlete can be numerous. But of particular attention is growth plate injuries in young athletes. And we have to take care of our youth league athletes because some of these growth plate injuries can come back to haunt them later on in life. And I've seen that clinically with some patients that I've worked with who are overhead athletes. Injury prevention really comes down to education. That's why everyone's here tonight, as well as implementing protective strategies. Obviously, proper strength and conditioning, we want to build up tissue resiliency and capacity in these athletes so they're game ready. But we have to respect where they are in their growth and development. How you're going to train an 8 to 10-year-old athlete is going to be different than someone who's 16, 17, or 18 years old because of their neuromuscular development. And just like Dr. Sylvia mentioned about coaching the fundamentals, coaches are instrumental in teaching these athletes the proper biomechanics, especially at a youth league level. But coaches also can promote proper habits with these athletes, teaching them warm-up routines prior to practice and games. And we also need to control overexposure, and we need to promote proper recovery in these athletes to minimize repetitive microtrauma, which leads to injury. The thing is with fatigue and pain, what the studies have shown is that in the presence of fatigue, that it reduces motion acuity, so a breakdown in their biomechanics. In the presence of pain and fatigue, it alters activation patterns of the rotator cuff musculature, which can lead to impingement syndrome and joint instability issues, as well as starts to create a reduction in range of motion in the shoulder. The sources of fatigue, can be a lack of proper preseason training, but on the flip side of that, there's probably some athletes that overtrain. They're utilizing too aggressive a strength and conditioning program during the season, and they begin to lose tissue capacity and resiliency, and they start to develop repetitive use injuries. Also, overexposure during single games and throughout the season. This is where pitch counts are instrumental as far as youth league athletes. And also, the athlete has insufficient recovery following athletic competition. The bottom line is that coaches really should be looking for impairments in the athlete's performance, break down their body mechanics, but you got to talk to the athlete, ask them if there's anything wrong. If an athlete's having pain in their shoulder or elbow, that's something that they just don't play through. You got to pull them out of competition and get things checked out for these athletes so they don't continue to injure themselves. If we look at some of the impairments here that place the overhead athlete at risk, we've talked about ligamentous laxity a lot tonight and joint instability, but I want to just show you a quote here from Kevin Wilk, who's a physical therapist who's probably written the book on rehabilitation for overhead athletes, and he indicates that the overhead athlete needs to be loose enough to throw, but stable enough to prevent symptoms. So our challenge is trying to get these athletes strong, build up their endurance, their neuromuscular control in order to have that dynamic stability. So we're not teetering on that portion of excessive joint laxity. But when we lose that because of the effects of fatigue or pain or if they're injured, now we're teetering more towards joint laxity, and now we're setting them up for a potential instability issue. I'm going to kind of jump around through a few slides here to save some time, but the overhead athlete's very unique as far as their range of motion. Overhead athletes develop adaptive changes in their dominant arm compared to their non-dominant side. They typically will have greater mobility into what we call external rotation, which is this motion. But they start to actually lose a little bit of mobility going into internal rotation. I'll use myself as an example. I played baseball all the way through my youth and teenage years, and I'm a southpaw, I'm left-handed. And I could pretty much come back about this far into external rotation, but I can go about this far on my right arm, okay? When I go into internal rotation, I can go to about here without compensating, but I can go a bit further on my right side. So I have likely a structural retroversion that I developed probably between the ages of 12 and 14 when I was pitching a lot at a youth league level. But my total arc of motion, if it's healthy, should be relatively symmetrical. I mean, if you measured my total arc, it should be within 5 degrees of one another. So that's what we need to look for in these athletes. If you're a physical therapist, athletic trainer, you need to break out your goniometer and measure these athletes. And what the studies have shown, what the evidence shows, is that when that total arc of motion is within 5 degrees of the non-dominant side, which is relatively symmetrical, and that internal rotation deficit is within a 10 to 12 degree difference, that's what we would probably find as a normal finding in these athletes. Those athletes, we want to just maintain their flexibility through a regular stretching program. But the athlete on the left-hand side who has a total arc of motion deficit greater than 10 degrees, or they demonstrate what they call a glenohumeral internal rotation deficit, or what they call GERD, when it's greater than a 20 to 25 degree deficit compared to their non-dominant side, athletes are 2 to 4 times more likely to develop a shoulder or elbow injury. And so these athletes need to be identified early, and they need to be put on a pre-season stretching program for at least 6 weeks before the season. So these are some typical stretches that athletes will do. We use this quite often clinically with people with various shoulder problems, including subacromial impingement. But to improve internal rotation, the cross-arm stretch, as well as what we call the sleeper hold stretch, are effective in improving internal rotation range of motion of the shoulder. And these athletes that develop glenohumeral internal rotation deficit develop that because they start to have adaptive changes to the musculature on the backside of their shoulder, the infraspinatus and teres minor, or the rotator cuff. And they may also develop tightness or contracture of their posterior capsule of the shoulder joint, which will predispose them to that glenohumeral internal rotation deficit. And that particular pathology could result in labral injury as well as impingement syndromes for these athletes. They also, you can have GERD in the shoulder, but you can also have a sick scapula. This is really, this diagram here on the right-hand side shows a young lady who you can see has very prominent winging of her shoulder blade. Her shoulder blades are further apart, and I use these lines on the top to show how her shoulder blades are downwardly rotated. If this young lady is an overhead athlete, she's going to have some serious problems. Elite overhead athletes, elite tennis players in particular, they found that they typically have more upward rotation of their shoulder blade or their scapula because they have very good development of their serratus anterior muscle as well as their trapezius musculature. So this individual needs to be identified early, and they need to be put on a corrective strengthening program right away. When we look at strength and conditioning for these athletes, really injury prevention comes down to a total body approach with the overhead athletes. Like Dr. Sylvia had mentioned, a lot of force is developed through the lower body. A tennis player who does an overhead serve is generating about 54% of the force from their legs. And then that kinetic energy is transmitted up through their stable pelvis and a stable trunk, which is ultimately transmitted through the shoulder and the elbow and the wrist. If there's a breakdown in this link further down, that's going to cause increased strain on the shoulder and the elbow and can lead to injury. So the basic principles of a strength and conditioning program with these athletes is to utilize variable resistance and velocity, but focusing on high repetitions to build up endurance. This is where Throwers 10 programs come into play, as well as implementing plyometric exercise programs, as well as focus on strengthening the backside of the rotator cuff, the teres minor and the infraspinatus, which is commonly weak in overhead athletes. These programs have been shown to enhance performance. I mean, the Throwers 10 and plyometric exercise programs in college, high school, and youth league level athletes has been shown to improve their throwing velocity. But you also got to focus on that kinetic link. You got to integrate exercises that are going to challenge single limb balance and trunk stability, as well as hip and pelvic mobility and control. And you need to focus on multiple joints as a functional unit. And the bottom line is you got to build up these athletes' level of athleticism. We also need to keep in mind incorporating sport-specific tasks. I mean, if you're a pitcher, you got to throw the baseball if you're going to, effectively build up your tissue capacity and resiliency and get back as far as game ready into your sport. And this is where interval training programs come into play, and we're starting to see it more with tennis, swimming, and volleyball as well. I'm going to show you some exercises here. This is the strength in the infraspinatus and teres minor. The one on the far left-hand side, very simple exercise, but it's also very effective. That probably produces some of the best electromyographic activity of the infraspinatus and teres minor. But we also want to train the athletes in positions that they're going to be in. If you're a thrower, we do want to do some strengthening exercises in abduction and external rotation if the athlete is asymptomatic. I mean, if this is a healthy athlete without injury. Clinically, we may change things up a little bit differently. The subscapularis is a vitally important muscle. Those of you who are physical therapists in the crowd, I mean, you know, this is an important stabilizer of the shoulder joint. And it has moderate to high activity throughout the overhead throw, especially during the acceleration phase of throwing. So this is a primary muscle that we need to strengthen in these athletes. Now, scapular stabilizers, some basic exercises here like a pullback. Then you start getting them on their stomach and you start working what they call prone scapular stabilization exercises. And these exercises isolate the middle, lower trapezius, but they're also very good at isolating the supraspinatus, which is an important rotator cuff muscle as well. And this is really the hallmark of a thrower's 10 program to include these exercises. We talked about the serratus anterior tonight. The serratus anterior is very, very important. And in elite baseball and tennis players, they demonstrate increased recruitment of this muscle during the overhead throw and serve. And this muscle helps to upwardly rotate the shoulder blade. And that's important because that's going to help reduce subacromial impingement. So in these athletes, we really need to train that serratus anterior muscle. This is also very, very important in swimmers as well. Best thing you could do is get them up into elevation and upward rotation of the scapula, working on some drills such as a tennis ball tap, having them do various arm circles. So you're working on neuromuscular control of those muscles around the shoulder blade, the trapezius, the lower trapezius, and the serratus anterior. And then getting them on one leg. Have them do diagonal patterns while standing on one leg. Build up their athleticism, build up their trunk stability and hip mobility, get a little bit more sport specific. And then you want to challenge their trunk stability. The one on the top left of the screen there, what we call the side bridge, that's probably one very, very excellent trunk stabilization exercise. Produces a good activity of the quadratus lumborum, the obliques in particular. And there's a lot of variations that you can do off in this exercise. If there's any trainers in the crowd, physical therapists as well, you know this. Getting them on a physio ball, so taking some of the basic exercises that are part of a thrower's 10 and then starting to put them on a little bit more of an unstable surface. And this is where the advanced thrower's 10 program is starting to come about now. They're starting to change up the exercises a bit more. Also interval programs for sport-specific training. You know, they're practical, functional, they're progressive. But you got to make sure these athletes are asymptomatic. The bottom line is doing a stepwise progression in order to build up their tissue capacity and resiliency. The goal is to get them to throwing, as far as like a pitching athlete, to gain volume. So if we put it all together real quickly, the bottom line is you got to identify the impairments, particularly in range of motion. You got to find out if they do have pathological glenohumeral internal rotation deficit. You need to identify postural impairments and identify any impairments in trunk control and single limb balance. And if they do, they should be referred to the proper sports medicine team, and they may need some rehabilitation for a period of time to get them to the point where they can start getting to more sport-specific activities safely. But it's very important that coaches implement, you know, dynamic warm-up and stretching exercises, cardiovascular warm-ups for their athletes, as well as implementing some of these programs like a Throwers 10 program during the preseason. You know, 3 days a week over the course of 4 to 6 weeks is by and large what some of the studies are doing. And that would probably be at least a good recommendation to start with. And then getting them going into interval throwing program to build up tissue resiliency and get them game ready. Make sure you're keeping good surveillance over these athletes. Pitch count's very important. Monitoring for signs of fatigue and pain. You got to get them out of the game if they're having any problems. And then make sure that they're having a structured rest period for throwing athletes, at least 3 months off from overhead sport. It's particularly important for baseball pitchers. So know your guidelines of your sport. These are some sources that are on the web. Near the bottom there, our PowerPoint presentations will be posted at that link. And also, the Upper Valley Sports Education Foundation also has a website that has very good information, as well as other links as well for information on injury prevention. And these are some of the references. If anybody does want to have any of these studies, I can certainly send you PDF files. You can certainly just leave me your email address, and I can do that easily for you. Thanks.